Welcome to week 2, class. This week we will explore the various types of careers found within the health information management industry. We then explore the various HIM professional associations that these professionals affiliate themselves with. These associations provide continuing education opportunities as well as vital networking opportunities for their members. We then shift our focus to exploring the various types of managed care models and what long-term care looks like in the United States. But first, let's take a moment and review what we've learned in week 1. We started off reviewing a brief history of medicine. Once we hit the modern era, we reviewed how a health organization is structured. After gaining an understanding of this structure, we dipped our toes into accreditation and the organizations that make this process up. Lastly, we landed with a very brief overview of legislative efforts in the United States that have had an impact on healthcare in the last 10 to 15 years. With this review in mind, let's dive into what a career looks like in this particular industry, as well as how care models are structured and deployed. Let's jump right into the various careers available to prospective professionals in this industry and talk about being a cancer registrar. Remember that in week 1 I mentioned that the importance of this role cannot be understated. These professionals collect cancer data from a variety of sources and report cancer data to the required agencies for statistical analysis. They work very closely with a very diverse grouping of healthcare professionals as well. There are college-based cancer registry management programs available for the interested individuals. Continuing education is also available once formal education has been received. There are several types of employment opportunities available for professionals in this career as well. Coding and reimbursement specialists are very important to an organization because if services are not coded correctly, payment will be delayed or denied altogether. This career option requires some formal college training, with some programs also requiring additional professional practice hours after graduation. There are several associations that professionals in this career field can become members of. I'd like to call out the American Health Information Management Association in particular, or more commonly referred to as AHIMA. This association administers exams to credential professionals in a wide range of fields. Employees in this career field can find work with hospitals, government agencies, and insurance providers. The Chief Information Officer is responsible for all technologies for an individual organization. Think we will implement X EHR over Y EHR as an example. This is an executive position and typically is not a starting point for individuals in the healthcare industry, but rather a progression. The nice thing about this role is that CIOs exist in almost every industry, so employment opportunities are plentiful once you gain the knowledge and experience. Similar to the CIO, the Chief Knowledge Officer, or CKO, is a member of the administration as well. This individual leads the strategy for sharing knowledge across the entire organization. The main goal for this individual is to improve patient safety, outcomes, and satisfaction through the increased knowledge of employees organization-wide. The Health Information Manager is responsible for being the expert in managing patient health information and medical records, administering computer information systems, and coding diagnoses and procedures for healthcare services provided to patients. This person is typically the subject matter expert with direct influence over how patient information is managed. Individuals in this career field typically earn an associate's degree and become health information technicians first. While they are in this field, they often work towards a bachelor's degree so that they can make the jump and take the national certification exam administered by AHIMA. There are several employment opportunities for someone in this career field, and more than a few are listed at the bottom of this slide. A certified health data analyst gains credentials through AHIMA as well. Individuals in this role analyze health data for a variety of purposes, and employment opportunities are incredibly diverse as well. Certified document improvement practitioners help healthcare facilities comply with government programs and other initiatives driven by accrediting agencies. AHIMA also offers credentials for this career field, and that credential is the CDIP. Moving on, a certificate in healthcare privacy and security is a credential that's also offered by AHIMA, and it demonstrates a professional's competency in healthcare data and information privacy as it relates to security issues. This is an ever-increasing role as security takes center stage in how we protect health data. Health insurance specialists receive a variety of education depending on the specific employer. Third-party payers prefer to hire college or vocational school graduates. Many like to provide on-the-job training as well. This is the role that some gravitate towards because of the work-from-home potential. That said, there are many opportunities in the hospital, clinic, and insurance setting. Health services managers plan, direct, and coordinate the delivery of healthcare in a variety of settings. Employment opportunities exist in several venues, including the clinic and individual healthcare organizations. Medical assistants perform routine administrative and clinical tasks to keep the offices and clinics of professionals running smoothly. These are not physician assistants or nurses, but they do have the ability to perform a wide variety of tasks. Typically, a medical assistant comes in with an associate's degree. Medical transcriptionists transcribe pre-recorded dictation, creating medical reports, correspondences, and other administrative materials. We reviewed this field a bit in week 1, but essentially it's the process of taking verbal recordings or direct communications and translating them into written word for a variety of uses. Now that we've covered a few potential career fields, let's move on to the professional organizations that one can affiliate themselves with as well as gain credentials from. First up, let's review the American Academy of Professional Coders. Coding certifications offered by the AAPC are listed below. The American College of Medical Coding Specialists award the following certifications listed on this slide. The American Health Information Management Association awards several different certifications, including the 3 listed below. Like I've already mentioned, there are many career fields available outside of what we've already listed. A few others are as followed: a consultant, a medical office manager, medical staff coordinators, privacy officers, quality managers, risk managers, utilization managers, and vendor salespersons. Once an individual has gained the appropriate knowledge for a particular function, the only limits are those that you place on yourself. In a sort of call to action, I would like to encourage all students to join your professional associations. There are numerous benefits, and I've called out a few already. You gain access to a treasure trove of publications and networking opportunities. You also get website access for a variety of use cases and a reduction in fees for certification exams required by your profession. Lastly, scholarships and grants are made readily available for members that deserve them. I personally am a member of AH112, and I could go on and on about the benefits until I'm blue in the face, frankly. I'm a firm believer in the notion of success being a direct result of an individual. These organizations are there to augment that individual as much as possible so that we are able to reach our potential as professionals. In Chapter 3, we explore the healthcare setting as a whole and hone in on specific venues and the differentiation between them. We all have sought treatment in some form from one of these institutions, so I want to remind each of you to continue to connect this material back to your personal experiences. When we think of health organizations, the traditional image of a hospital likely pops into each of our minds. These traditional images of healthcare organizations are what we would consider acute care facilities. Acute care facilities contain single, standalone hospitals, multi-hospital systems, ancillary services, acute care, and short-term care, as well as long-term care. The concept of a hospital can be broken into several categories. Critical access hospitals are facilities that are more than 35 miles away from another hospital or critical access hospital. These are typically smaller facilities and are oftentimes incredibly isolated. General hospitals provide a wide spectrum of emergency services and basic care. Specialty hospitals are those institutions that have a specific focus. For example, children's hospitals or cancer institutes are examples of this. Rehabilitation hospitals are facilities that specialize in the rehab of patients for a variety of reasons. An example is we have a patient who is involved in a severe car accident. They have been treated, but rehab is required for them to return to normal functions. This patient could be admitted to a rehab facility so that they can relearn these normal functions. Lastly, behavioral health hospitals specialize in the treatment of patients with mental health diagnoses. There are also several types of hospital patients. Ambulatory patients are patients that are treated and released same day. A length of stay maximum is typically less than 24 hours. Ambulatory surgery patients are patients that seek surgical services and are released same day, as they do not oftentimes require extended care. Emergency care patients are patients that are in need of urgent care due to health problems. The goal here is to either release in under 24 hours or admit them to an inpatient area. Inpatients are traditional hospital patients. They have been admitted for a variety of reasons, and their length of stay is longer than 24 hours. Next up, newborn patients. Pretty obvious here, but these are patients that are newly born. Observation patients are patients that require observation, but the provider is not yet ready to fully admit them. This is done so that the care provider can assess the situation to see if it necessitates admission as an inpatient. Lastly, subacute care patients are those individuals admitted in specialty care institutions. Think back to my example regarding the car accident. This individual was a subacute care patient. Let's take a moment to discuss some alternate care facilities. Behavioral health care facilities treat patients with mental diagnoses. Home care allows people who are very ill or dying to receive treatment at home. Health professionals travel to the patient's house to administer a wide range of healthcare services. Hospice services provide comprehensive medical and supportive care to terminally ill patients and their families. I have had direct experience when my mother was enrolled in hospice care, and from personal experience, these professionals are incredible. They not only treat the patient but ensure that the family is doing okay as well. In a terminal illness situation, we shift care towards comfort because curative efforts are no longer having an impact. Lastly, there are long-term care facilities. These are your nursing homes and rehab facilities for individuals needing ongoing assistance in their healing process. As a class, let's focus in on long-term care, because honestly, it's an incredibly important component to the overall healthcare delivery discussion. Again, we're talking about your nursing, social, and rehab services for individuals that need continuous health-based assistance. These services can include adult daycare, assisted living, retirement communities, intermediate care facilities, long-term hospitals, residential care facilities, and lastly, skilled nursing facilities. Continuing on with the theme of connecting the content with you personally, I'd like to share a side story about a friend who used one of these service offerings and its overall impact. Dave had an aging father that lived with him. His father started to become forgetful, almost to the point that Dave worried each time his father took a walk individually. Dave needed someone or some group to watch out for his father during the day, but he was adamant that his father continues to live with him rather than being enrolled in a nursing home. Similar to childcare, there are adult daycares available to individuals in this types of situations. Dave no longer has to worry about this because he drops his father off at this facility for care while he's at work. The facility offers a wide range of activities for his dad, and the peace of mind for Dave individually is just tremendous. There are, of course, other types of care facilities in the U.S. that are federal, state, and local healthcare institutions. There are correctional facilities, military health systems, the Veteran Health Administration, as well as U.S. Public Health Services. In closing, we've explored several different careers available under the Health Information Management umbrella and the associated professional organizations for each. We've also reviewed the various components of acute care facilities and, more in depth, an overview of long-term care facilities. Chapter 2 and 3 contain a wealth of information, so I'd encourage each of you to perform a thorough review to ensure that you have a full understanding of all facets of this individual discussion. In week 3, we reviewed the specifics of a patient record and the different types of data available within it.